This is Orthoflix, a site where you need to know anything about orthopedics and trauma. You will find it here. So my name is Dr. Had. For those who are checking for the first time, ensure that you subscribe and click the bell so that you can be notified whenever there's a new video on Orthoflix. Last time I was talking about rheumatoid arthritis, and today I'm going to talk about Achilles tendinitis. I hope you learned something. Stay around, never disappointing. Thank you. The Achilles tendon is the largest tendon in your body. It connects the two calf muscles to your heel bone called the calcaneus. So the Achilles tendinitis is an overuse injury of the Achilles tendon. Mostly occurs in runners who have suddenly increased their intensity of duration in their runs. It is also common in middle-aged people who play sports such as tennis or basketball only during the weekends. So most cases of Achilles tendinitis can be treated with relatively simple at-home care under your doctor's supervision. So self-care strategies are usually necessary to prevent recurring of episodes. More serious cases of Achilles tendinitis can lead to tendon rupture or tendon tears that may require surgical approach or surgical repair. What are the symptoms? So the pain associated with Achilles tendinitis typically begins as a mild ache in the back of your leg or above the heel after running or after sport activities. More episodes of more severe pain may occur after prolonged running, strenuous climbing or sprinting. You might also experience tenderness or stiffness, especially in the morning, which usually improve with midday activities. What causes Achilles tendinitis? Achilles tendinitis is caused by a repetitive or intensive strain on the Achilles tendon, the band of tissue that connects your calf muscles to your heel bone. This tendon is used when you walk, run, jump, or push up on your toes. The structure of the Achilles tendon weakens with the age, which can make it more susceptible to injury, particularly on people who only participate in sports on weekends or who have suddenly increased the intensity of their running programs. What are the common risk factors of Achilles tendinitis? So a number of factors may increase your risk of Achilles tendinitis, including sex and age. Achilles tendinitis occurs most common in middle-aged men. Physical problems. A naturally flat arc in your foot can put more strain on the Achilles tendon. Obesity and tight calf muscles can also increase tendon strain. The training choices. Running in worn-out shoes can increase your risk of Achilles tendinitis. Tender pain occurs frequently in cold weather than warm weather, and running on hilly terrains also can predispose you to Achilles injury. Medical condition. People who have diabetes or high blood pressure are at a higher risk of developing Achilles tendinitis. What about the medication? The medication, certain types of antibiotics called fluoroquinolone have been associated with a higher rates of Achilles tendinitis. Fluoroquinolone antibiotics. Complications. So Achilles tendinitis can weaken the tendon, making it more vulnerable to tear or rupture, a painful injury that usually requires surgical repair. Diagnosis. During the physical examination, your doctor will gently press on the affected area to determine the location of pain, tenderness or swelling. He or she will also evaluate the flexibility, alignment, range of motion, and reflexes on your foot and ankle. Imaging tests that a doctor might ask for. Your doctor may order one of the following or more tests to assess your condition. X-rays. While X-rays cannot visualize soft tissues such as tendons, they may help rule out other conditions that causes similar symptoms. Ultrasound scan. This device uses sound waves to visualize soft tissues like tendons. Ultrasound can also produce real-time images of the Achilles tendon in motion. The MRI. Using radiation waves and very strong magnet, MRI machines can produce very detailed images of the Achilles tendon. The treatment and medication. So Achilles tendinitis usually respond well to self-care measures, but if your signs and symptoms are severe or persistent, your doctor might suggest other treatment options. for example, surgical approach. Over-the-counter pain medications such as ibuprofen, Advil, Mortin IB, other like naproxen sodium L aren't enough. Your doctor might prescribe stronger medication to reduce pain and inflammation. Physiotherapy. A physical therapist might suggest some of the following treatment. Exercise. Therapists often prescribe specific stretching and strengthening exercise to promote healing and stretching of the Achilles tendon and its supporting structures. Orthotic devices. A shoe insert or wedge that can slightly elevate your heel can relieve strain on the tendon and provide a cushion that lessens the amount of force extended on your Achilles tendon. Surgical approach. If several months of conservative treatment don't work, or if the tendon has torn or ruptured, your doctor may suggest surgery to repair your Achilles tendon. Lifestyle and home remedies. While it might not be possible to prevent Achilles tendonitis, you can take measures to reduce your risk. Increase your activity level gradually. If you are beginning an exercise, start slowly and gradually increase the duration and intensity of the training. Take it easy. Avoid activities that place excessive stress on your tendon, such as hill running. If you participate in a strenuous activity, warm up fast by exercising at a slower pace. If you notice pain during a particular exercise, stop and rest. Choose your shoes carefully. The shoe you are wearing while exercising should provide an adequate cushioning for your feet or your heel and should have a firm arch support to help reduce the tension in the Achilles tendon. Replace your worn-out shoe. If your shoes are in a good condition but don't support your feet, try arch supporters in both shoes. Stretch daily. Take a time to stretch your calf muscles and Achilles tendon in the morning before exercise and after exercise to maintain flexibility. This is especially important to prevent recurrence of Achilles tendonitis. Stretch your calf muscles. Strong calf muscles enable the calf and Achilles tendon to better handle stress they encounter with activity and exercise. Also do cross training. Alternate high impact activities such as running and jumping with low impact activities such as cycling and swimming. Thank you for staying around. Next time you feel pain in your heel, ensure to check up with your doctor. Thanks for watching. Ensure you subscribe and click the bell so that you can be notified whenever there's a new video on Orthoflix. Thank you. If you need to know anything about orthopedics and trauma, I got you covered. Thank you.